This is a gory one. For as long as there have been humans to be affected by illnesses, there have been ways of treating those illnesses, primitive and outdated as they may be. Over the course of history, our methods of curing various medical afflictions have had a less than spotless track record, with some treatments actually making the condition worse rather than better. You're watching Top Trending, and today we're counting down the most horrifying ways we used to treat basic medical issues. Coming in at number 10, we have bloodletting. In past times, doctors believed that the human body was divided into 4 primary substances: black bile, yellow bile, phlegm, and blood. These fluids were called humors, but bloodletting really isn't that funny. People thought that those 4 substances needed to be in balance for you to be healthy, so if you were ill, it was mostly blamed on blood overflow. As the name suggests, bloodletting was used to drain the body of that bad excess blood. It would involve a doctor cutting a vein off the patient and letting the blood drain out into a bowl. There was actually a strangely beneficial side effect to bloodletting, as it temporarily reduced the patient's blood pressure, which could be useful if the patient was suffering from hypertension. However, hypertension was mostly undiagnosable with ancient methods, so this side effect was totally unintentional, and bloodletting mostly ended up harming the patients. Bloodletting is actually still practiced to this day. Well, maybe not exactly like it was in ancient times, but drawing blood for laboratory analysis or blood transfusion is actually not that different from bloodletting, except that we have more modern tools and do it for entirely different reasons. Number 9 is a treatment for well-known lung infection, tuberculosis. This procedure is one that seems completely ridiculous and senseless. Would you strain your lungs even more if they were infected? Probably not, but that's basically what the treatment known as plombage did. The lungs of patients were filled with acrylic balls, which were the size of golf balls, to allow them to rest. No, not allow the balls to rest, the lungs. Somehow the balls were thought to relax the lungs and heal the wounds inside the lungs that were caused by the infection. So far so good, putting balls in the lungs, okay. That, however, wasn't even what caused all the negative side effects. The big issue was that these balls often weren't even taken back out. As you can imagine, this led to infections even worse than the ones caused by tuberculosis. The balls could even end up being grown into your lungs. The moral of the story here is if you ever plan on putting balls inside your lungs, don't forget to remove them afterward. Our number 8 item, hydrotherapy, may sound like some form of torture like many of these entries, but really it was thought to be a cure for various different illnesses in the early 20th century. The basics honestly don't sound that bad. Hot or cold water that was applied to the body would cause reactions that could cure a number of illnesses. However, the details are pretty frightening. Patients would usually be stuck in these water baths for many hours, or even days. If that wasn't enough, the baths were mostly held in small, silent rooms with little to no light. Sometimes the patient would also be wrapped in sheets that had been dipped in different temperatures of water. These sheets would be kept on for hours at a time, causing great discomfort. Most people enjoy taking a relaxing bath, but bathing alone for days in almost complete darkness and silence while being exposed to a few different temperatures at once sounds rather horrifying. The treatment is actually still used today, but the methods now are very different. The most common forms of hydrotherapy are underwater massages and exercise, which definitely sounds more relaxing. At number 7, we have electroconvulsive therapy. Electroconvulsive therapy, or simply shock therapy, was first introduced in the 1930s and was primarily used to treat depression, but doctors also used it on patients with various other psychiatric disorders. 2 electrodes were placed over the temples of the patient, which would send alternating currents throughout their heads. This caused immediate loss of consciousness and even induced seizures. Most patients would receive this ETC treatment 3 times a week over a period lasting anywhere from 2 to even 6 weeks. In certain extreme cases, if the patient was severely ill, they would even receive the treatment up to 3 times on a single day. Shocking, huh? In the 1960s, as new medications were developed, ECT began to see a decline. This didn't last long though, as in the 1970s, ECT treatment was improved. The patient's comfort was more important, delivery methods were improved, and enhanced anesthesia was managed better. Shock therapy is still used today, and many people believe it to be one of the best treatments for mental illnesses. However, it is only used on patients who don't respond to many of the other more humane medications available today. With number 6, we're getting into the more horrifying practices, so if you don't like seeing anything disgusting, you should probably look away now. Hemiglossectomy is the scientific term for removing a rather big portion of the tongue in order to treat stuttering. The instruments used for this practice were an assortment of scissors, knives, and pincers, which makes the whole treatment seem more like a form of torture. In the mid-1800s, a German surgeon believed that stuttering was caused by certain spasms in the voice box that resonated up the length of the tongue. These spasms could apparently be cured by cutting a triangular piece of the tongue out, turning the patient into a human snake. The first patient this was tested on was a 13-year-old boy, and in total this treatment was used on hundreds of patients across France and Germany. A big portion of the patients bled to death, and the method was never proven to work on anyone. If you think about it, it kind of worked. They tried to cure stuttering. After bleeding to death, you won't stutter. What a genius method. Like many other techniques on this list, even hemoglossectomy is used today, albeit very differently than in the 19th century. These days it's used to remove dangerous cancerous growths on the tongue. If number 6 made you squirm, this entry on the list won't make you feel much better. While this is not directly a treatment for pneumonia, rib resection had to be done in order to perform the real treatments for the illness, which aren't much healthier but definitely a little bit less scary. Before antibiotics existed, there was no proper way to get rid of the pus in someone's lungs. To prevent the lungs filling up with liquid, which would cause the patient to drown, the lungs had to be drained. Think of that like bloodletting, except a tiny bit less bad and more advanced. The true horror, however, was getting to the lungs. If you have some basic knowledge about anatomy, you know that the lungs are protected by several ribs. This meant that the ribs got in the way of the treatment, so they had to be removed. The patients were cut open, had half of their ribs removed, and then the doctors could perform the actual pneumonia treatment. Sadly, but not surprisingly, very few people actually survived rib resection. Turns out you can't just remove half of a person's torso without them dying. Who would have thought? At number 4, we have a treatment that may not be as horrific as other treatments on this list, but it definitely deserves a high spot for reasons that'll make sense later. Mercury these days is seen as a poisonous metal that you should never ever ingest in any way. Mercury and glass thermometers are now mostly banned, even though they were used to measure body temperature for many years. So who would ever think that mercury helps the body? Obviously, people from ancient times did, otherwise it wouldn't be on this list. Most people historically believed mercury to be a cure for syphilis. Surprisingly, this actually turned out to be true in some cases, so doctors weren't totally wrong about it. Most of the time, though, people who took mercury would die from liver or kidney damage. Number 3 is probably one of, if not the most well-known treatments on the list. Lobotomies are often used in entertainment media because they are very disturbing, but unfortunately still very real. Like the shock therapy mentioned earlier in this list, lobotomies were used to treat mental illnesses like schizophrenia, depression, or anxiety. Nerve pathways in a lobe of the brain were severed from those in different areas. This meant that the doctors had to drill a hole in the patient's skull. Test results interestingly showed some improvements in the mental health of patients, but failed treatments that led to even more health problems largely overshadowed those results. And the lobotomy had a bad reputation once it reached the United States. But that didn't stop it from being called a miracle procedure later on. The opinion on lobotomy likely changed because of the introduction of transorbital lobotomy. This treatment consisted of an ice pick-looking tool being forced through the back of the eye socket, which pierced the bone that separated said socket from the frontal lobe. The same pick would then be used to sever the connections inside the brain. This may not be any less horrifying than the original version of the lobotomy, but it didn't require drilling a hole through the patient's skull, which made the procedure easier. Number 2 I'm sure will sound comical, but it definitely isn't. Hemorrhoids are not pleasant in the slightest, so if you have them, you'll obviously want to get rid of them. However, the method used historically to get rid of hemorrhoids was rather extreme. Doctors would use one or several red-hot iron pokers to burn the hemorrhoid and make it explode. It was even sometimes described as cooking them, which seems accurate but makes it even more disgusting. Don't worry, that's not all. Some cases were pretty serious and couldn't be treated by just cooking the hemorrhoid with normal iron pokers. If the patient had an extreme case of hemorrhoids, a tube would be inserted into their anus, and the doctor would slide hot blazing iron in and out of it until the hemorrhoid separated. Seriously. And this wasn't just some crazy medieval practice. A book published in 1882 called Fistula, Hemorrhoids, Painful Ulcer, Stricture, Prolapsus, and Other Diseases of the Rectum still mentions the red-hot poker and calls it the ideal method to treat hemorrhoids. Obviously, this method had many negative side effects, and some patients even died from it. Scary as this may be, it's definitely an interesting way to die. And finally, at number 1, we have trepanning. Definitely one of the worst, if not the worst, surgical procedures ever performed. Trepanning is an ancient practice, stemming back from the Neolithic period in history, 10,200 to 2000 BC, according to fossils recovered. Unlike all the other illnesses we've mentioned over the course of this video, trepanning was a practice reserved for people perceived to be under the influence of evil spirits, as opposed to an actual real illness. And the extremity of the treatment really only makes the fact that it wasn't even curing anything really more terrifying. So what is trepanning? I've stalled long enough, but it's a practice that involves drilling holes into the subject's skull, exposing the outermost layer of the membrane surrounding the brain in an attempt to force the evil spirits to leave one's body. Yeah, it wasn't just used for evil spirits, but also as a method of treating wounds gained through fighting. That is, removing shattered bits of the subject's skull from inside their head. Yeesh. Listening to those old cures can be unsettling to say the least, but it's interesting thinking about whether people of the future will look back at us and say the same thing about our medication right now. Maybe there are ways we're treating diseases now that'll be completely inconsequential in the future, as technology and medicine develops. This kind of concept is shown through the likes of Samuel Arbesman's The Half-Life of Facts, which is a rough estimate in any field of study as to the length of time before half of the knowledge of the field is shown to be incorrect. It's a question we thought about but can't really come up with much answers to, as it's difficult to predict that sort of thing while you're living in the time period in question. And that's our list. Did you agree? Disagree? Want to share any treatments we may have missed? Let us know in the comments section. We love hearing from you. If you enjoyed the video, feel free to like the video, share with friends, and subscribe to Top Trending for more regular countdown videos such as this one.